leaves, maybe at this level. Probably maybe even this quiet. Hello. It's quite quiet.
I'll go 100. I'll leave it on.
1, 2, 3, 4, 5, 6, 7,
I was just hitting it.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
Good afternoon. Thank you to everyone for being here this afternoon. I'm Helen Mason, Chief Executive of Bay of Plenty District Health Board, and I'm here speaking on behalf of the Chief Executives of the 20 DHBs. With me today is Dr. John Tate. Dr. Tate is Chief Medical Advisor of Capital and Coast DHB, and John is here speaking on behalf of our senior clinicians from across the country. And I'm pleased today to have Jim Green with us. Jim Green is Chief Executive of Tairāwhiti DHB, and Jim is also a nurse. What we're going to have happen today is that we'll make some brief statements. John is going to talk about how things are going so far today with the industrial action. Jim is going to be able to give us a perspective of what it's been like for his DHB preparing for this and what it's like in his DHB today. I'll then add in some brief comments after that. What I would like to say is that another reason for Jim being here is I'm going to be away for a couple of weeks, and whilst I'm away, Jim has agreed to be lead CE for the NZNO negotiations whilst I'm away for a few weeks. So with that, I'd like to pass on to Dr. Tate.
Do you guys need to move the microphones, because John will be speaking for a bit, and if you want to give
Kind of handy probably for most people, but I've got 2 minutes. Give us a few words, please.
Good afternoon. Nice to see you all again.
Yeah, we will.
Thank you.
Sorry, so I just thought it might be a bit easier for you guys.
Yeah.
Thanks, Sarah.
Good afternoon. The first thing I'd really like to do is acknowledge the tremendous work that's been done by a large number of people all around the country who have been working extremely hard and will continue to work just as hard to keep our communities safe until 7 o'clock in the morning. The fact that the response so far has gone to plan, and I think this again is a testament to the efforts of the DHB over the past 3 months in getting their contingency plans working so well. It's also been reported to us that the hospitals have had more staff and volunteers come to work than planned, and that occupancy levels are as expected. Again, importantly, from a patient safety point of view, the arrangements for life-preserving services are working as planned, and it's important to thank the members of NZNO who have made themselves available to work and to provide the life-preserving cover. And we're also very grateful for the cooperation and support from NZNO, who have been assisting with the LPS cover. We're also grateful to the health professionals who have gone that extra yard today to ensure patient safety. General practice is also helping, and most emergency departments have had less patients than one would expect this time of the year. Having said that, we would like to continue to reiterate the message that we've been telling us, that if people are ill or injured, they need to access the hospital or ring 111 for an ambulance. We still have a few hours to go before the strike, so we hope that the response that's been going so far continues to work. I know in my own hospital we have cover organised, and hopefully that will continue to provide a safe haven for our community. Thank you.
Thanks, Dr. Tate, and I'll now pass on to Jim Green to give us a perspective of what's been happening in Tairāwhiti DHB.
Thank you, Helen, and thanks for the opportunity to be here today and talk a little bit about what's been happening in my own DHB. The preparation work has been very extensive, and I really want to give credit to the numbers of people that have been involved in that. Quite a wide range of people across the DHB in management and in clinical leadership positions, particularly with that clinical leadership coming through to put the plans in place that, as John has described, seem to be working around the country, and that is very much, as he said also, as a result of the amount of effort that's going in today from people from NZNO that are part of the life-preserving services, nurses and other people who are volunteering to help out, and a lot of management staff in there as well, getting in and doing the work with the patients. I think that's been a very teamwork approach, and from my own experience this morning, being there in my own hospital as the nurses worked out, it was a very orderly process, and I was grateful for them to being so careful about handing over and making sure that people were kept safe, the patients and the staff that were coming into care at that time. And I know myself, I even experienced being there in the emergency department this morning, wanting to find something and asking one of the staff there, and they were very helpful in making sure that, you know, the equipment, the things are there that people need to be safe in this very trying situation. I also wanted to give a lot of credit to our colleagues within primary care, and it's very clear that that they are responding well to being able to provide care for people within the community and taking pressure off the hospital. That's very much appreciated, and I'm sure for all the people that are receiving care there, that's very reassuring for them as well, because we know the importance of general practitioners and staff and their staff in people's lives and making sure that they are safe. So while I would absolutely say it's a major event for us, and you know, obviously is not something that we would want to have, and we look forward to getting resolution of this so we can prevent that in the future. But I do have to say that you know, we've had that degree of cooperation and support from the nurses and from the other members of staff to be able to get through this difficult time.
Thanks very much, Jim. So I'd like to reiterate Dr. Tate and Jim's comments in terms of thanking everybody who has put so much effort into preparing for today, as well as all of the people who are working today and volunteering today. I again want to make mention particularly of those NZNO members who are providing life-preserving services and who are making themselves available for emergency management as well. The work that's been done by NZNO with DHBs is deeply appreciated, and the fact that they're there providing those services and keeping our community safe is very, very much appreciated. Whilst today our focus is very, very strongly on patient safety and staff safety, we do need to start to think about how we move into the future. The facilitator from the Employment Relations Authority did release, did make her recommendations to DHBs and NZNO. Those have been made to the two parties, and DHBs are going to be considering those recommendations, and we will be making contact with NZNO to talk about the recommendations and to agree a path forward. The last thing that I'd like to say is just to reiterate those messages. If there's anybody at all who is concerned about their health, they should not hesitate to attend one of our ED departments. Remember that you've got access to GPs, you can access care through your pharmacy. Nobody should hesitate to dial 111 if they require care. On an urgent basis. People who have made themselves available to ensure that our communities will be safe. Thank you.
Can you tell us what those recommendations are that Employment Relations have?
The recommendations are recommendations which have been made to the two parties, and we're going to be considering those, and together with NZNO we will be determining how we move forward with those.
But you can't reveal what those recommendations are? And so at what point will you be in contact with the NZNO?
We'll be in contact with NZNO shortly to agree a path forward.
Is that after the strike or during?
At the moment, our focus is absolutely on the safety of our patients and our staff and our communities. That's what our focus is on today. Absolutely.
Have you had to put any extra staff on in hospitals further than the Hawke's Bay one this morning?
John, are you?
Well, the short answer to that is yes, in terms of health professionals coming in to help during the strike to ensure that the wards are covered and that ED works very closely. So yes, we've put on, there are more SMOs, there are more RMOs, there are more allied health professionals.
But for demand today, have you had to bring in?
No, in fact, I can only speak for Capital Coast Health. We've actually sent people away because demand isn't there, or there's enough staff there to cope, particularly from a volunteer's point of view. So we've not had to use the volunteers, we've had enough of our own staff to provide the care.
If I can just support Dr. Tate's comments, something that we have seen across a number of DHBs, and I think that Dr. Tate had said this already, but we have had more people attend work than we had anticipated, and more people attend to volunteer, which has been deeply appreciated. We do have a mixed picture. And so there are some DHBs where, with what they've had, and as Dr. Tate has indicated for his DHB, there hasn't been a requirement to call in additional staff. My understanding is that there have been a couple of other DHBs where, through the winter load, they have been seeking additional staff.
Where are those DHBs?
I'm not going to, at the moment, I'm not going to comment on which DHBs. But the thing that I will say is that we feel in a fortunate position that we have the emergency management pools, that we do have people to call on and to bring in. It's the middle of winter, it's really busy.
You said yesterday that one of the things the facilitator would be doing was looking at the latest offer and deciding whether or not it addressed the concerns of the NZNO enough. Can you say whether or not the recommendations have shown that you did?
I'm not going to comment on the recommendations today. That what we focused on as DHBs is giving them really deep consideration, and it's very important that in terms of considering those recommendations that NZNO has the opportunity to do that, and their members do, and we want to work closely with NZNO on how we approach the recommendations.
And Jim, can I ask, obviously you will be taking over negotiations. Have you been involved from the get-go, or are you coming into it?
Obviously, I've been part of this, as all of the DHB chief executives have been part of this over this time. There will be things that I will need to catch up with over the next day or so to get to the level that Helen has been involved in this, and I'm confident that that will be possible. For instance, the process from here on that we need to agree with NZNO.
So, thank you all very much indeed for your time, and if I can just take the opportunity to reiterate how hard we're working to keep patients and staff alike safe. And for anybody who does have an urgent medical concern, please do not hesitate to dial 111 or to attend one of our emergency departments. For anybody who's got a health concern which isn't urgent, think about approaching your GP or approaching a pharmacy, and you can also contact Healthline, the 0800 number. Thanks very much indeed. Thanks.
Thank you. Helen's?
That's not.
Yours. Okay. Right. Shall I turn it off for you?
That's all right, thanks.
Thanks.
Just also that you know that we do intend to